Do you have unusual skin signs and you aren't sure what it is? You could have diabetes. Watch until the end to find out more about diabetes. Unusual skin signs of diabetes you should not avoid. Diabetes affects millions worldwide, and its impact on the skin is often overlooked. But your skin can give you important clues about your diabetes management. So let's dive into some of these unusual signs you should be aware of. First up, let's talk about dry, itchy skin. If you're experiencing constant dryness and itchiness, it could be a sign of poor blood circulation or nerve damage, both common complications of diabetes. Next on the list, dark patches or velvety texture. Have you noticed any dark velvety patches on your skin, especially in the folds like the neck, armpits, or groin? This could be a sign of insulin resistance, a precursor to type 2 diabetes. Moving on, slow healing wounds or sores. Diabetes can impair the body's ability to heal wounds due to high blood sugar levels, which can damage blood vessels and affect the immune system. So if you notice that cuts or sores are taking longer than usual to heal, it's time to take action. Another important sign to watch out for is skin infections or fungal growth. Diabetes can weaken the immune system, making you more susceptible to infections and fungal growth, particularly in warm, moist areas of the body, like the feet and between the toes. Last but not least, yellow, reddish, or swollen skin. If you notice any changes in skin color, such as yellowing or reddening, or if your skin feels swollen, it could indicate underlying issues with your liver or kidneys, which can be complications of poorly managed diabetes. Remember, your skin is often a mirror reflecting what's happening inside your body. So, if you notice any of these unusual skin signs, don't ignore them. Instead, consult with your healthcare provider to get the appropriate treatment and make necessary adjustments to your diabetes management plan. Health effects of diabetes. Diabetes is a chronic condition that affects how your body processes glucose, a type of sugar that serves as a primary source of energy. When you have diabetes, your body either doesn't produce enough insulin or can't effectively use the insulin it produces. This leads to high levels of glucose in the blood, which can have various health effects over time. Some of the significant health effects of diabetes include cardiovascular complications. Diabetes significantly increases the risk of developing cardiovascular diseases such as heart attack, stroke, and peripheral artery disease. High blood sugar levels can damage blood vessels and nerves that control the heart and blood vessels, leading to atherosclerosis, hardening and narrowing of the arteries, and other cardiovascular problems. Kidney damage, diabetic nephropathy. Diabetes is a leading cause of kidney failure. High levels of blood sugar over time can damage the kidney's filtering system, leading to protein leakage into the urine, high blood pressure, and eventually kidney failure if left untreated. Nerve damage, neuropathy. Diabetes can cause nerve damage, particularly in the hands and feet. This condition, known as diabetic neuropathy, can lead to numbness, tingling, pain, and weakness in affected areas. It can also affect other organs, such as the digestive system, leading to issues like gastroparesis, delayed stomach emptying. Eye damage, diabetic retinopathy. Diabetes is a leading cause of blindness in adults. High blood sugar levels can damage the small blood vessels in the retina, leading to diabetic retinopathy, a condition that can cause vision loss or blindness if left untreated. Foot complications. Diabetes increases the risk of foot problems due to poor circulation and nerve damage. Even small cuts or blisters can become serious infections if not properly treated, potentially leading to ulcers, gangrene, and amputation in severe cases. Skin conditions. People with diabetes are more prone to skin conditions such as bacterial and fungal infections, itching, and slow wound healing. High blood sugar levels create an ideal environment for infections to thrive, and poor circulation can impair the body's ability to heal wounds. Mental health issues. Diabetes is associated with an increased risk of mental health problems such as depression and anxiety. The stress of managing a chronic condition, fluctuations in blood sugar levels, and concerns about complications can all contribute to mental health challenges. Increased risk of infections. Diabetes weakens the immune system, making individuals more susceptible to infections such as urinary tract infections, skin infections, and gum disease. Complications during pregnancy. Women with diabetes have an increased risk of complications during pregnancy, including high blood pressure, preeclampsia, miscarriage, preterm birth, and birth defects in the baby. These are some of the primary health effects of diabetes. However, with proper management, including medication, lifestyle changes such as diet and exercise, regular monitoring, and routine medical care, many of these complications can be prevented or delayed, allowing individuals with diabetes to lead healthy and fulfilling lives. Key points on how to avoid getting diabetes. 1. Maintain a healthy weight. Focus on a balanced diet with plenty of fruits, vegetables, lean proteins, and whole grains. Watch portion sizes and avoid overeating. 2. Stay active. Aim for at least 30 minutes of moderate exercise most days of the week. Choose activities you enjoy, such as walking, cycling, swimming, or dancing. 3. Watch your carb intake. Opt for complex carbohydrates like whole grains, fruits, and vegetables. Limit refined carbs and sugary snacks. 4. Limit sugar and saturated fats. Be mindful of hidden sugars in processed foods. Choose healthier fats like those found in nuts, seeds, and avocados. 5. Quit smoking. Smoking increases the risk of type 2 diabetes. Seek support and resources to quit smoking if you're a smoker. 6. Get regular checkups. Visit your healthcare provider regularly for checkups and screenings. Early detection and management of prediabetes can prevent the progression to type 2 diabetes. Foods to avoid to help prevent the onset of diabetes, along with explanations of why they should be avoided. 1. Sugary beverages. High in added sugars, which can spike blood sugar levels rapidly, leading to insulin resistance over time. 2. Refined grains. Lack fiber and essential nutrients found in whole grains, contributing to rapid spikes in blood sugar levels. 3. Processed foods. Often contain high amounts of unhealthy fats, sugars, and sodium, which can contribute to weight gain and insulin resistance. 4. Sugary snacks and sweets. High in refined sugars and low in nutrients, leading to rapid spikes in blood sugar levels and potential weight gain. 5. Fried foods. Typically high in unhealthy fats and calories, which can contribute to weight gain and insulin resistance when consumed regularly. 6. Fatty meats. High in saturated fats, which may contribute to insulin resistance and increase the risk of type 2 diabetes when consumed in excess. 7. High sodium foods. Excessive sodium intake can lead to hypertension and increase the risk of developing type 2 diabetes, especially in individuals with existing risk factors. 8. Alcohol. Can interfere with blood sugar control and contribute to weight gain when consumed in excess, increasing the risk of developing diabetes over time. 9. Fruit juices. While natural fruit juices can be high in sugars and lack the beneficial fiber found in whole fruits, leading to rapid spikes in blood sugar levels. 10. High-carb snack foods. Snack foods like chips, crackers, and cookies are often high in refined carbohydrates and unhealthy fats, leading to spikes in blood sugar levels and potential weight gain. By minimizing or avoiding these foods in your diet and focusing on whole, nutrient-dense options instead, you can help reduce your risk of developing diabetes and promote overall health and well-being. Remember to always consult with your doctor should you feel any unusual symptoms that do not feel right.